What if the biggest threat to your heart after 60 isn't what you eat, how stressed you feel, or even what runs in your family, but something you take every single day without a second thought? Open your medicine cabinet for a moment. Inside are pills that are FDA-approved, doctor-prescribed, and trusted by millions. Yet in aging bodies, some of these medications can quietly raise the risk of heart failure, stroke, dangerous falls, and sudden cardiac events. The most alarming part is that many older adults are never warned. Prescriptions get refilled automatically, side effects are blamed on just getting older, and risky combinations often go unnoticed. Today that changes. This video breaks down 5 types of commonly used pills that can damage the heart and overall stability in adults over 60, based on well-documented medical evidence. This isn't about fear or blame. It's about understanding how aging changes the body, and why medications that once helped can become harmful if they're not reevaluated. We start with a category almost everyone recognizes: everyday pain relievers like ibuprofen, naproxen, and diclofenac. These are known as NSAIDs, or non-steroidal anti-inflammatory drugs. They're used for arthritis, joint pain, back pain, and headaches, and because many are available over the counter, they feel harmless. But after 60, they can quietly strain the heart. NSAIDs affect how the kidneys manage salt and water. As we age, kidney function naturally declines, even when blood tests appear normal. This makes fluid retention more likely. Swelling in the ankles, sudden weight gain, or feeling unusually tired by evening are not always normal aging. Extra fluid forces the heart to work harder, increasing blood pressure and worsening heart failure risk. NSAIDs can also reduce blood flow to the kidneys, raising the risk of kidney injury, elevated blood pressure, heart attack, and stroke. Even short-term use can be dangerous when combined with common heart medications like diuretics or ACE inhibitors. Because these changes happen quietly, many people never realize the connection. The safest approach is not daily, long-term use without medical review. For many, alternatives such as acetaminophen, topical treatments, physical therapy, or heat therapy reduce pain without stressing the heart and kidneys. Next are medications often prescribed for sleep or anxiety, called benzodiazepines. Drugs like lorazepam, diazepam, and clonazepam slow activity in the brain and nervous system, which is why they help with sleep and anxious thoughts. In older adults, however, that slowing effect can go too far. Reaction time, balance, and muscle coordination are reduced, especially at night. Falls are one of the leading causes of serious injury and hospitalization in seniors, and sedating medications are a major contributor. Long-term use of benzodiazepines is also associated with memory impairment, mental fog, and increased risk of cognitive decline. Another concern is dependence. Over time, the body adapts, requiring higher doses for the same effect, and stopping suddenly can trigger withdrawal symptoms. If you're finding this information useful so far, take a moment to like the video and subscribe to BioOptimize Vision, because understanding how medications affect aging bodies can protect long-term independence. For sleep and anxiety, safer options exist, including cognitive behavioral therapy for insomnia, breathing techniques, light exercise, and non-sedating medications that don't carry the same risks. Now let's talk about a medication taken by millions for heartburn and acid reflux: proton pump inhibitors, or PPIs. Drugs like omeprazole and pantoprazole reduce stomach acid and are highly effective for short-term treatment. The issue is long-term use. Stomach acid plays a key role in absorbing nutrients such as calcium, magnesium, iron, and vitamin B12. When acid is suppressed for months or years, deficiencies can develop. Low calcium increases fracture risk, especially hip fractures. Magnesium deficiency can affect heart rhythm, cause muscle cramps, dizziness, and fatigue. Low iron and B12 can lead to anemia and nerve problems. PPIs also reduce the stomach's natural defense against harmful bacteria, increasing infection risk in older adults. Research has linked prolonged use to kidney disease and possible cardiovascular complications. PPIs are valuable when clearly indicated, but they were never meant to be permanent for most people. Regular reassessment is critical. Fourth on the list may surprise you: heart and blood pressure medications themselves. These drugs save lives, but dosing and combinations matter more with age. Diuretics can cause dehydration and electrolyte imbalances. Calcium channel blockers may lead to swelling and fatigue. Beta blockers can slow the heart too much, reduce exercise tolerance, and mask low blood sugar symptoms in people with diabetes. As blood vessels stiffen and kidneys filter more slowly, doses that once worked can become excessive. Many older adults take multiple heart medications at once, a situation known as polypharmacy. When medications stack up, side effects can multiply, leading to dizziness, weakness, confusion, and increased hospitalization risk. Regular medication reviews help ensure the goal isn't just good numbers on paper, but real-world strength, balance, and clarity. Finally, the most dangerous pill of all isn't a single medication, it's taking too many at once. Polypharmacy, defined as 5 or more daily medications, affects nearly half of adults over 65. Each added drug increases the risk of interactions, side effects, and organ strain. The effects are often subtle: fatigue, forgetfulness, digestive changes, mood shifts. Many of these are blamed on aging, when in reality they're medication-related. Often, drugs prescribed years ago are no longer necessary.
Everything
A
we
structured
discussed.
medication review with a
It
doctor
looks
or
like we have a
pharmacist
plan
can
moving
dramatically
forward.
improve
That
energy,
sounds
balance,
wonderful,
focus, and
Dennis.
quality of life. The key takeaway is simple. Aging changes how the body processes medication. What helped before can harm later if it's not reevaluated. If you or someone you love takes multiple medications, ask for a review. Protecting heart health isn't always about adding more treatments, it's often about using fewer, more carefully chosen ones. If this video helped you understand how everyday pills can affect long-term health, subscribe and follow BioOptimize Vision for evidence-based guidance every week. And if you know someone over 60, sharing this video could make a real difference.